phone.
Alaikum salam. I'll give a second to set up and we'll start, inshallah. Are we good to go?
Yep.
All right, bismillah. Assalamu alaikum, everyone. Thank you for joining us at our live Q&A at Traversing Tradition. For those of you who might be a little unfamiliar with us, Traversing Tradition is an online publication with the goal of addressing the most pressing issues of our time. We strive to provide varied perspectives on modern society through the lenses of Islamic theology, Eastern and Western philosophy, as well as historical analysis. So my name is Hannah Fareed, and I'm going to be moderating today's session, inshallah. We're joined today with Waqas Haque, the author of Islamic Investment in U.S. Healthcare. So starting off, can you tell us a little bit about yourself, who you are, what you do, and any initiatives you would really like to highlight?
Yeah, so assalamu alaikum, first of all, and Bismillahir-Rahmanir-Rahim. Thanks for having me on here. It's always great to join these sessions of Traversing Tradition. So I'm Waqas. I was originally from Pakistan and grew up in Texas, and studied medicine and went to college in Dallas as well, and had a pretty diverse background. I studied economics. I did some public health work as well, and now alhamdulillah, I finished med school this past May, and now I'm actually in residency working in the ICU. So it's been pretty busy this past few weeks, but alhamdulillah, I had an off day today, so good day to join and take part in this. And I think just going through college and going through my different places I studied at, I always saw like a lot of professionals and also students who were interested in kind of blending their religion and their interest in Islam with their professional skills as well. But I always thought that like even if people have these interests, sometimes they might not find a way to really like realize that or find specific ways to contribute. So that was really what I think motivated me to get more involved in different kinds of initiatives. So I was part of the IMANA, which is the Islamic Medical Association of North America, and did some work there for a couple of years earlier, and helped create, or I guess lead like their students residence section to help bring different med students and residents on board and kind of create different programming for them. And recently I helped start something new called Muslims in Medicine, which is really aimed at sort of bridging the gap between the different things I talked about and helping Muslim professionals, especially early stage professionals, find ways to lead patient initiatives and to chart new outcomes for us based on Islamic principles. So that's a little bit about me.
Yeah, that's really great. I'm also based in Texas too, so it's interesting. And those initiatives you worked on, is really great. So let's kind of jump into your article and the piece that you worked on. So in the article, you mentioned how revelation gives rise to civilizations and encourages social institutions to fulfill philanthropic mandates. Can you elaborate a little bit on that concept?
Yeah, sure. So I think one thing that like everyone can agree on, whether you're Muslim or not, is that the words and the kind of phrases that you use have a shape on how you think about life, right? So, for example, like when you think about like American, like really capitalist society we live in, like we always talk about time in terms of money, right? Like you're wasting time or you're killing time or I'm going to save some time, right? You think of it like in a very like capitalistic or business kind of mindset. Or if you think about time, or if you think about like seasons, like other societies, they thought of it in a very cyclical way, right? So I think people can all agree that like the words and ideas you have and the way you phrase them have an impact on how you see things. So from an Islam perspective, I think it also applies the same way. If you think of certain ideas like the importance of family in Islam, like we know, like we've all heard the saying that like half your deen is starting a family and getting married, right? Or if you think of the idea that the three things that benefit someone after they die are, charity, and then, having a righteous child who prays for you, and also leaving behind, beneficial knowledge, right? So if you think about like, some of the people who created these grand mosques, or even like Taj Mahal, I'm sure that they probably thought of this idea that I want to leave something in the long term after me that people can benefit from. So I think there's really this connection between the Hadith and the Quran and kind of the ways that we do things in life, and that's kind of what I mean by revelation, giving birth to civilization. And even if you think about the Quran, right, it describes Abraham or Prophet Ibrahim as a nation, right? If you think about it, like in his time, like he probably barely had any followers, but his impact on world history is obviously momentous, right? I mean, his influence lives on across billions of people in the world today. So that's kind of what I was talking about.
Yeah, I think it's really important when discussing kind of principles of faith, not only discussing it in kind of a private matter, but how you can impact the community around you and, just philanthropy in general.
Yeah.
So in your article, you mentioned how the Islamic world has waqf or endowments,
Right.
which was abolished as a result of imperialism. So can you highlight some historical events that resulted in this happening?
Yeah, sure. So, just for those who might not be familiar, one of the sort of ideas for philanthropy in Islam that really materialized across different societies was the idea of waqf, or like a charitable endowment. And it's actually, I would even say that the idea of like the trust in the Western system is actually adopted from the waqf system in Islamic countries. The first Western trust was actually uh, 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 Merton College and Oxford University, and there's actually some research that the founder of Merton College actually was very influenced by Arabic and Islam. So I just want to start off by saying that. So these endowments are the idea that you can have like a masjid or mosque and have a clinic and have a school, all these things kind of in one complex, and they kind of support each other. Not only that, but like having these endowments allows people who are less like who are lower income or like you don't have the same opportunities to like have some kind of stable income. I just want to start by giving that context. In terms of specific events that led to the destruction, I think it's really just the I think just Muslims losing their political power because obviously these endowments had to be under certain kinds of documents, and the idea is that these are really like inalienable, and they couldn't just be used like for private gain or like just for someone's own profit. They had to be used like for a specific purpose. So I think once that really broke away, then the waqfs really started going down. So I think that was a huge issue. And just to give some more context, the waqfs were also like a major source of empowerment for females in like Muslim societies. I think I once read uh, like a fact or something that like over half or two-thirds of the waqf in Egypt were actually like started by women, right? So it was actually a way for a lot of people to get involved in philanthropy. So unfortunately, like we don't really have that as much anymore, but there are some efforts to kind of revive it, including like Islamic Relief. They're actually working on something similar.
Yeah.
Yeah.
So that kind of translates right to, maybe if we were living in an Islamic society, but how would you kind of navigate that in a place like the West in America and, you know, uh, implementing these kind of endowments and supporting the community in that way?
Yeah, that's a great point. I think it's a challenge as Muslims because like we only make it 1% in this country, right? And even if you look at being Muslim, then there's I mean, there's South Asian Muslims and you have Pakistani Muslims. So then like within that strategy, you still have all these kinds of divisions. So the question is like, what do you do, right? We're not even like 5 or 10% of the population. Even if we're a minority, then we still have some kind of influence, right? But unfortunately, like on a numbers perspective, we're not that strong, and that's just a reality. But the thing is that in terms of nonprofits, in terms of business, in terms of starting foundations, there's really nothing that stops us from getting involved there, right? All it takes is one Muslim who's like, like a millionaire to start funding things and start making an impact. Like, Kyrie Irving, like I think he apparently like became Muslim a few months ago. So imagine like if he started like using his shoes and like his Nike, deal to like start promoting Islam, right? It would have a huge impact. So
Mm-hmm.
I think that even if we're small in numbers, we can still make a big impact. So that's kind of my thoughts on that.
Yeah. So, kind of going back to the topic of history, a lot of people look towards practices that happened within the dark evil or medieval time with a lot of disdain. And, can you touch upon how the medieval world was different in the West versus during Islamic's golden age, and as well as key differences in relation to healthcare?
Yeah, it's a great question. So I think you look at it from two different ways. There's a lot of similarities and then some key differences as well. So I think in terms of like general medicine, it's not like Muslims practiced a very different medicine than what people in other parts of the world did, right? I mean, medicine is medicine. If something helps someone get better, you're going to do it regardless of if they're Muslim or not. And at the time, if you look at someone like Avicenna or Ibn Sina, he was, following a lot of the Greek school of medicine, which had the idea of humors, right? So there's different chemical forces in the body, and you kind of balance them out because there's like a disease that's caused by an imbalance, right? So I think that was kind of similar between Muslim and European societies historically. I don't think it was that different, and I would say Muslims made contributions in that end. I do think one difference though is that the way like we approach medicine, the way we approach science. So there's like this really well-known Islamic thinker whose name is Sayyid Hussein Nasr, who I'm sure like some of you all have heard of. And actually, one thing he thought or like remarked is that the industrial the industrial revolution never would have happened in Islam or like in a Muslim civilization. And the reason why isn't because Muslims were bad at math, right? Like there's someone named like Al Jibr who helped like create algebra, right? Like we know all these
Yeah.
stories. Not because we're bad at math or science. It's that we would never conceive of using our knowledge to actually like pillage all the Earth's resources and destroy the Earth and to use people as like mere machines or objects, right? Like we wouldn't do any of those things. If you look at most of the contributions to science and arts that by Muslims, they were actually in line with nature, right? So if you look at the astrolabe, it wasn't like trying to go against the ocean or trying to destroy it. It was actually trying to harness like nature to like figure out where you're going and like figure out prayer times and like navigation, things like that. So I think the key difference is like the mindset that you take
Mm.
when you approach medicine. So if there's a Muslim like a non-Muslim doctor, it's not that Muslim doctors like prescribing a different medicine than
Yeah.
non-doctor, right? But for the most part, it's just that it's like just the values that you have when you approach it.
Yeah.
Yeah.
So you mentioned how Muslims, we kind of, at least in the West, we have the wealth and the capital and the talent, as well as religious directives to serve humanity. But there are no Muslim-owned hospital chains, especially compared to like the Catholic and Jewish community. So, two questions: what barriers are really creating this problem, and what are some challenges and opportunities to really overcome these barriers?
Yeah. So in terms of the first question about why Muslims haven't done this, so I'll just give some context to people who might not be in healthcare, but I'm sure a lot of people know that there's a lot of Muslims here who are in the healthcare field, right? And there's actually a study that was published last year in JAMA that 4.5% of all doctors in America are actually from majority Muslim countries, right? And these are just international graduates, not doctors like me who are actually from America. So probably you can even see like maybe 6-7% of Muslims are or sorry, doctors are Muslim, which means that if you look at patients, like there's a very high chance that they probably have a Muslim doctor, right?
Yeah.
So you have all these Muslim doctors, and doctors make a decent amount of money. And, they so if we have money, if we have the numbers, if we have all these different things, right? The question is like, why don't we have like our own Muslim hospital chain, right? Like, why don't we have our own huge endowment, things like that, right? And I really think like the answer is really simple. I think it's just a lack of willpower, because I think that a lot of the initiatives that people have started in other areas, all it took is a few people, right? Like if you look at the Jewish community, like they account for 20% of Nobel Prize winners, but they're only 0.2% of the world's population. So there's a huge effect, right, that they have, even though they're so small a number. And I think that there's just a lack of interest in people like really dedicating their lives towards just like towards like serving the deen. It's really just as simple as that. Like just to go back to the Jewish community, for example, I like a tech networking event just the other day, and I was sort of mingling with some people, and I met two people who work like for the Israel Economic Commission. So they actually like work for the Israeli government, and they actually connect Israeli businesses with American businesses to like for venture capital, right? So I think the first thing is really just a lack of willpower. I think if even a few people had the effort in like initiative, it could easily be done. So that's the first part, right? But there are some practical challenges as well. I think for one thing, like Muslims are very new to this country, so like we have a lack of political experience, a lack of nonprofit experience. So when it comes to things like starting a board, right? There's actually like people actually study this for their lives, like how to make a board, like who to put on there, right? How to like adjudicate powers, how often to have turnover, right? Who gets to set the agenda, right? All these different things. And there's even like for boards like in Wall Street and these big companies, there's actually laws about how you regulate these things, right? But if you look at like your shura board at the masjid, like it's just a bunch of uncles arguing, right? So it's just a lack of experience. That's like one thing. And then I think another thing, yeah, is just a lack of structure. So those are like two challenges. And I guess also, like if you want to think of it from like financial perspective, right? Like if a Muslim wanted to start a hospital, he'd have to probably get a loan, but like most loans are probably not going to be very halal. So that's like another thing. So those are like a few challenges. In terms of ways to I think in terms of opportunities though, there are a ton of opportunities, right? So if you look at like the Affordable Care Act, right, Obamacare that was passed, about a decade when it was coming out, there were actually like a lot of Christian and Jewish, faith communities that were actually reaching out, with the government to help enroll people in Obamacare, right? Like because like there was a whole debacle like about signing up and like how hard it would be to enroll, right? But they were actually like these faith institutions that were helping out enroll people. So I think that we just have to look out for opportunities. There's so much healthcare reform going on. It's such a broken system, right? So I think finding ways to give people healthcare would be a huge opportunity. And like there are some examples, by the way, of Muslims doing this. It's not like it's not there. There's a Shifa clinic in Houston. There's ICNA, Islamic Circle of North America, that has all these different mobile clinics and clinics across the country, including one in Dallas, actually. There's things like that. And also I read like another survey from a couple of years ago that like among free clinics that are run by masjids, like they serve over 50,000 patients a year, both Muslim and non-Muslim, and I think like there might even be more non-Muslim than Muslim patients. So there's definitely opportunities there.
Yeah. Just to address a question that I saw in the chat, someone asked, does perhaps colonialism or white supremacy have an impact on Muslims not being able to kind of serve in this way?
I honestly don't think so, right? Because anybody can start a business, anybody can start a nonprofit organization. There's nothing that stops you or me from doing that. In fact, in Muslim, there might be more restrictions than in America, right? In America, I mean, if you look at all the scholars who are really popular and giving speeches and all that, right? Where are they coming from? They're not coming from the Middle East. They're all coming from America. And there's quite a few of them in Dallas, actually, right? So I don't think that's a barrier at all, right? It's just about having agency and like looking at things from a broader perspective. So I personally don't think that's a limitation. I think the one area where it is kind of challenging in one sense is that because like there's a separation of like church and state, like a lot of people, especially in healthcare, like they might not be comfortable like blending those two things together. It's like when they're in the hospital, they only like see themselves as a clinician, but not necessarily as a Muslim, right? And I think that's really not the right way to go, because like in medicine specific, like especially like there's this whole emphasis on diversity now. So like if you're LGBT or like if you're Hispanic or if you're African American or if you're female, there's all these different things about equity and like promoting your identity, right? So for a Muslim, like why can't we do the same thing? Why can't I say like I'm a Muslim, right? Why can't I have one kinds of things promote outcomes for Muslim patients, right? So it's just a lack of willpower, as I said. Yeah.
So how can the perception that Islamic nonprofits are not professional be addressed?
Yeah.
So to what extent is this perception actually based in reality, and what changes need to be made both internally in the organization and publicly to kind of change this perception?
Yeah, sure. That's a great question. And by the way, like I only have limited nonprofit experience. I can't speak for all nonprofits and for all industries. I mainly work in the healthcare area. So I just want to give that context. Yeah, so I think so. Like, if anybody's interested in this topic, like about like starting organizations, I highly recommend Peter Thiel's book 0 to 1. So some of my thoughts are kind of come from that. But like one of the first things he says in his book is that when you start an organization, you want to start it right from the very beginning. Because if you don't start it right at the very start, it's going to cause a ton of problems down the road that might be hard to change, right? So I'll take one easy example, right? Take the Constitution, right? We had it since 1787, right? So about 230 years. And I think most people know that like it's barely been changed in 2 centuries, right? I think it's been changed like 27 times in like 230 years. So basically, it takes about 10 years for like one change to the Constitution. So, and like that's because like from the very start, it was a certain way, and like then it takes so much effort to change it. So really, the main thing is like we have to create new organizations that get it right from the very start, right? So if you have an organization that's not professional or like that doesn't have the right values, it's very hard to actually change it like internally, because there's already certain people there that have a certain mindset, and you can't really change it. But if you have the idea to like start something professionally, you can even like be a copycat, just take that same organization but just do it the right way, and I think things would be much better.
Yeah, I think that's a really good insight, and I think it goes back to kind of the Islamic concept of like doing things with ihsan. And if you start things off right, it really sets the tone for how things kind of go along later.
Oh, yeah.
To the audience, if you guys have any questions, feel free to drop them in the chats or even DM us. And if you want to stay anonymous, just mention that, and I'll make sure not mention your name. But to continue on with the Q&A, so in an age where civil rights and activism are the crown fields of service, how can we show our communities the charitable value of boosting Muslim achievement in both health, business, and education?
Sorry, can you say the question one more time? Sorry, this is a little long. Okay.
It's chill. So, in an age where civil rights and activism are the crown fields of service, how can we show our communities the charitable value in boosting Muslim achievement in health, business, and education? So, in a sense,
Okay.
kind of how do we empower our community?
Yeah, it's a great question. So, this might be a little controversial, but I'll just go ahead and say it. I think that, like a lot of Muslims, are really focused on political activism, which is great, right? Like it's really important to be, having Muslim candidates and having them run for office and winning seats. I mean, that's really great and that's awesome, right? But the thing is, like, if you have a Muslim senator, they can't just be a Muslim as a senator. They have to like appeal to like 100 other groups, right? They're not just serving Muslims. They're only like 1% of the population, right? So you can't really have leverage if you're in politics, especially as
Mm,
like we are. But I think if you look at business, right? If like someone started a business and it becomes big, then you can actually use that to promote Islam, right? And if you look at a lot of companies that are run by people of Jewish like identity, right? What do? Like they start a company, they're very successful, and then they give a lot of their funding to politicians who support Israel, right? And they're
mm,
like constrained by the political system because they're on both sides. They're on the Republican side and on the Democrat side. So no matter what, they're always winning because they always have someone who's basically supporting them. So I think that it really starts with creating organizations that promote our values. So, for example, having a free clinic that serves patients is one thing that we can do, and then creating a network of them would be one practical thing.
yeah. So, here are some questions that were submitted by the audiences. So, a question from Wasid Wahood. What are some common pitfalls on this particular topic, and how do we avoid them?
Yeah, so I think one pitfall might be that you look at Islam just as like an identity, but not actually looking at what it is, right? So, as I mentioned before, right, like there's all these different groups, like African American or
Mm,
Hispanic or LGBT, right, where it's about identity, right? In Islam, like I'm saying, like of course, like identity is important. It's about who you are, and you should be proud of that. But it's also about your values and what you do and like what's internal, right? So I think that's
mhm,
one important thing to keep in mind. You want like you shouldn't just come to these kinds of organizations and then just try to promote diversity. You should come in from like an Islamic framework and then try to promote these things. Because if you're not really if you don't have like a basic understanding of some of the Islamic sciences and some basic principles of Islam, then you might not actually be doing a service for the ummah. So that's just one pitfall, I think.
yeah, yeah, definitely playing, really embracing kind of the uh,
Yeah,
really embracing the kind of not just the identity kind of politics surrounding it, but really embracing those principles.
yeah, definitely.
Um, so if there aren't any more questions from the chat, I'm just going to ask you if you have any concluding thoughts or really kind of main takeaway messages in regards to this topic of Islamic investment in U.S. healthcare.
Yeah, sure. So I think I'll just begin with one sort of general idea that's not really specific
Mm-hmm.
general thing, right? The fact that like if you have like a professional skill, whether it's in medicine or business, engineering, finance, like whatever field it is, right? There's always a way to like make an impact or to serve Islam with that kind of skill set. Like I really don't think there's a limitation in that, right? So if you look at the Sahaba, right, like the first generation of Muslims, right, like they had different kinds of skills and they actually applied it. Like they weren't just people who just stayed in the mosque all day and like just prayed and that's it, right? Like they did a bunch of things, right? Like if you look at Abu Bakr and Omar and Uthman and Ali, I mean they were basically politicians. They were administrators, right? But they were also like promised paradise, right? So there was no kind of conflict in that sense. If you look at Khalid ibn Walid, right,
Mm-hmm.
he didn't know much Quran, but like he was a warrior, right? He fought his whole life and he obviously spread Islam to all these different countries, right? Sa'ad ibn Waqas, right? He was also a commander and administrator. He used those skills, right?
Yeah.
If you look at Aisha, right? She was a scholar. She knew thousands of hadith and she relayed them, right? And so she used her memory and her insight. So I think it's about using your talents to serve the ummah, and I think like people shouldn't create like such a big division between like deen and dunya. Like I think both things can be promoted at the same time. So that's one thing. The second thing is that you shouldn't think that just because like we're minorities or like we're only a few people that we can't have an impact. I think like for one thing,
Mm-hmm.
like all it takes is one person. Like everyone has a social network of 1,000, right? So if you influence like 100 people, right, they're gonna tell 10 people as 1,000, right? Then that becomes 10,000, then a million, then a billion, right? So even like a small thing you do might have a huge ripple on society, and you might not even know when you're going to have a huge
Mm-hmm.
impact. So like for example, like there's like a random example, but like some people like would criticize Imam Ghazali really on for like not writing a lot about politics or like not getting involved too much in that. One interesting thing is that after he passed away, like there was someone who actually carried two books with him, right? Salahuddin Ayyubi, who was a commander, right, that helped conquer Jerusalem, and there were actually two books he always kept with him. It was the Quran, and then it was a Risala by Imam Ghazali, right? So I think that we shouldn't think that just because we don't have the numbers, it doesn't mean that we can't have an impact. And even in the Quran, like there's like several verses that talk about this idea, like in the battlefield, like even if you have like one Muslim fighter, you can still find like 1,000 or 100, like fighters on the other side. So there's that idea too. And if you look at Prophet Ibrahim alayhi salam, like he's described as a nation, as I said before. So we shouldn't think that just because we're limited in numbers doesn't mean that we can't have an impact. So I think that's that other thought I have. Yeah, just one more thing, I guess, if there's no more questions. So one thing
There is one
oh,
more question, if you don't mind. So from Ali, it says, is there any advice for NPO targeted towards fixing the liberal secularist paradigm within the future physician demographic?
Yeah, good question. Yeah, thanks, Ali, for the question. Yeah, I think it's interesting. I mean, going through med school, like in my med school, there were actually 12 to 15 Muslims per class, and like I think like
Oh.
half were practicing, and they were kind of MSA kind of people. It was very chill and easy to get along with them. But then like there are a few who might have a Muslim name, but like you don't really say along to them, or you don't even ask.
Mm-hmm.
So I'm not sure if that's like in other fields as well. But yeah, like in medicine, I have experienced that myself, and also like with attending sometimes, like I'll see like they have a Muslim name, but then when I ask for time off for Jummah, I'm like, can I have 30 minutes for Friday prayer? Because like they might not be practicing. So yeah, it's interesting. I'm not really sure how to fix it. But I think one thing we can do is like if you're someone who has like the right kinds of mindset, is to actually go and like start an organization or something that and then also work with people who have the same mindset as you, and then everything that flows from that will naturally be in line with our principles, right? So if you look at something like like Omar Suleiman's organization, Yaqeen Institute, right? Like obviously everyone he works with, or like for the most part, they're like practicing, like regular Muslims, and as a result, they have a lot of great output, right? But if you look at organizations, and I won't name them, but like who might be started by people are different kind of values, and the stuff you get out of it will be in line with that. So it's just about promoting your values, I think, at the end of the day. So
Yeah.
yeah,
Yeah, I think just like you said, just to summarize, just being mindful and taking initiative is a big part of it, making impact on society.
yep, exactly.
Yeah. So if that's all we have for today, I guess I'll end the live. Thank you so much for sharing your valuable insights with us today, and we're really grateful to have a lot of hardworking, committed people like you, kind of in the field of medicine, striving to improve people's lives and represent Islam. And thank you to the audience for joining us. Our live Q&A will be recorded, so if you guys want to look back on it, it'll be on our social media, and make sure to follow us on Twitter, Facebook, Instagram, and follow us for more articles that will be looking at modern society through a modern lens, inshallah. We hope you guys have a wonderful rest of your day.
Just one more thing I'd like to throw in there before we end this live. So earlier this year, I started an initiative called Muslims in Medicine. So I think not just me, but a few other people as well. So inshallah, just go to muslimsinmedicine.com. We're on social media. We're on Facebook, Instagram. We're trying to create different kinds of initiatives and programming for Muslims in their early career in med school and residency who are interested in creating different kinds of organizations or initiatives that are Muslim led. So a couple of things that we're working on is we're working on creating a stronger presence in like the New York area, because that's where I am right now, and inshallah work with ICNYU, Islamic Center of NYU, hopefully, and try to create some kind of panel for pre-med students and some kind of networking. And also we're working on like a networking platform that'll basically like connect people for like one-on-one like networking based on their interests. So if you're like a fourth-year med student applying to residency in like orthopedic surgery, and there's like someone in Florida who's also applying to orthopedic, or like they're an orthopedic resident, then like it'll basically connect you based on your interests and based on your other interests like global health or research or whatever it is. So inshallah, we're working on that. We're also setting up a new website. So these are just some things we're working on. And as I said, like a lot of this stuff is not like stuff that I invented or like is brand new. It's really just taking things that are already out there and just putting an Islamic touch on it. That's pretty much just what I wanted to say. So
Yeah.
thanks for having me on, and thanks for doing this Insta Live.
Yeah, of course. And you guys can follow Muslims in Medicine on Instagram, inshallah, as well. May Allah protect and preserve you guys and grant you guys a lot of success as well. So thank you guys, everyone, for tuning us with us. And, just keep in touch and follow Traversing Tradition as well, inshallah. Assalamu alaikum.
Long everyone. Take care.